Welcome back at 8:13. A newly approved device could help people in life-threatening situations. It treats allergic reactions using a nasal spray. Dr. Reena Mehta with Uptown Allergy and Asthma joins us to explain how this works and what the FDA study found as far as the efficacy is concerned with the spray. Good morning. Thank you for being with us.
Thank you for having me.
So let's first talk about the FDA approval process. What did the studies find with this spray, and what's it called?
Okay, so this nasal spray is called Neffy. So it is epinephrine for your nose. So when you think about anaphylaxis and allergic reactions, the only life-saving method that we have is an EpiPen. Okay, so this is like an EpiPen for your nose, but needleless, without the injection. And so looking at a combination of 4 different studies, they found that the safety profile and the efficacy of Neffy, the nasal spray, is comparable to the EpiPen.
And so you were saying it does seem like, oh, this is so much easier to use than an EpiPen, and it technically is, but you still were saying you have to know how to use this properly, because again, it's in a moment that you're trying to save someone's life and it's being used.
Yes, in a severe allergic reaction, time is of the essence, as we talked about earlier. And so it is important to be properly trained and make sure you are a good candidate for this nasal spray. However, we do know that many patients with EpiPens are scared to use them. Studies have showed that 52% of patients who actually have an EpiPen refuse to use it during the moment. So if this is bringing down a barrier to treating reactions, then let's go for it. You know, if it's a nasal spray that makes you more comfortable, the studies show that you will use one nasal spray. It's almost like Narcan, where it's a single dose into the nose.
Into each cavity? Or
into one. And then 20% of patients will probably need a second dose.
Okay.
So when you get the kit, there's 2 nasal sprays in there. Each one has 1 dose in it. And then obviously, if you're using the nasal spray because you're thinking that this is anaphylaxis, then you should go to the emergency room for further monitoring.
Dr. Mehta, I know when it comes to EpiPens, in the past there have been kind of a twofold issues with EpiPens. One, the needle part of it, or 3, I should say. 2, the availability of them, and 3, the price.
Exactly.
And would this new option kind of tackle any of those or all of those issues, in your opinion?
That's the hope. So, you know, this just got FDA approval about a week and a half ago. And so it's going to take about 8 weeks for this product to hit the shelves, to hit the pharmacies, to figure out what the insurance coverage will be. But what we are thinking and understanding and learning is that if you have commercial insurance, theoretically a pack of 2 will be about $25 if it is covered. If it is not covered, then the company is saying it'll be about $200. So that is expensive, but of course EpiPens are expensive.
Right.
And so sort of weighing those options, it's probably going to be a comparable cost to what an EpiPen would cost anyway.
As an allergy doctor, how exciting is it, price aside, insurance issues aside, for this second option to possibly be available to your patients who, again, sometimes are in moments where, I mean, again, time is of the essence. Seconds are life or death. How exciting is it that this other option could soon be available for your patients to use?
Tremendously exciting, because we all know that people are scared to use a needle, especially in kids, especially on themselves. Even in my office, where we treat a lot of anaphylaxis, to have this quick and easy way to treat it without having to do a shot is huge for our patients. Now, I must say, it's FDA approved currently for patients 66 pounds and higher.
Okay.
So it's not yet there for our littles yet. It will, hopefully, you know, because like I said, efficacy is good and the safety profile was also good. And so it didn't show many adverse reactions to the nasal spray.
And especially if this is something that a small child's going to have in their backpack at school, easier to administer for the child, for a teacher, for a caregiver. So this is a game changer.
For the school nurse, yeah.
Yes, this is amazing.
Exactly.
This is so interesting, and we'll be talking to you as this moves through. Again, it's been approved, but as it moves through the process of ending up on store shelves. We appreciate your time this morning.
Thank you so much for having me.